My name is Kenna Shah. I'm a physical therapist with Select Medical. So, in the first section, I'm going to talk about causes of low back pain and some of the common medical jargon used. Prevalence of low back pain. As per the World Health Organization, 619 people experienced low back pain in 2020. It is one of the leading causes of disability. That means 80% of the adults will experience low back pain at some point of time in their life. So peak incidence of low back pain happens between 50 to 55 years. Low back pain is very common in females. The impacts are greatest among older people aged 80 to 85 years old. And recurrent episodes of low back pain are common with aging. And that's the more reason that we need to go and seek some treatment and appropriate treatment to make sure we have the best quality of life. So what does it look when it comes to healthcare costs? Low back pain is associated with high direct healthcare costs, such as increased outpatient visits, hospitalizations, and other interventions. It is also associated with indirect costs from lost productivity and absence from work. Low back pain is one of the most common reasons for physicians' visits and a major driver of healthcare utilization and disability in the United States. So we have put together this slide to kind of tell you guys more about the contributing factors for low back pain. Here, we have put together 4 major categories. So the first category, which is the biological factors, which includes age, female gender, high body mass index, prior episodes of low back pain, any more increased wear and tear or degenerative changes of the spine, any other specific spinal pathologies or problems that puts you at a common or at an increased risk for low back pain. The second category is physical and occupational factors. Sitting or standing prolonged positions, repetitive incorrect lifting techniques, any exposure to vibration, like people who drives the bus or trucks, they're exposed to repetitive vibration, or someone who kind of operates heavy machinery, any other manual tasks that involves awkward postures, they are more prone to low back pain. There is other third category, which is the psychosocial factor. High levels of depression, high levels of stress, high job dissatisfaction puts you at an increased risk for low back pain. And the last category is high body mass index, smoking, sedentary lifestyle, or inactivity can also put you at a risk for low back pain. However, if you modify this category, that can decrease your chances of low back pain. So the stages of low back pain. When you have the back pain that lasts for a few days to 6 weeks, that's categorized as acute low back pain. When the low back pain is lasting anywhere from 6 to 12 weeks, we classify that as subacute low back pain. And any low back pain that goes over 12 weeks is the chronic low back pain. So types of low back pain. The first category, which is the non-specific pain, this is one of the most common category. There is no clear identifiable source or no clear structural abnormality that can kind of be like, okay, this is why I have the low back pain. It's usually a complex interplay of psychological factors, social factors, and biological factors that puts you at a risk for low back pain. The second category is the specific pain. Here, there is an identifiable source. The low back pain can be coming from either disc herniations. It can be coming from narrowing of your spinal column, which is the vertebrae, that is termed as stenosis. It can come from any fractures. It can come from tumor or infections. In the third category, which is the radicular pain, in this category, the low back pain does not just stay to the low back, it actually starts radiating down your legs. And most likely, there is a nerve root that can be involved, which causes this pain down your leg. There may or may not be any weakness associated with this category. And the last category, which is the referred pain, in this category, the source is either the hips or something to do with the pelvic area or any kind of something, some pathologies from the abdominal area that can cause low back pain. So what are the common sources of the low back pain? When you look at the spinal column, the vertebrae itself can be the source of the pain. The muscles and the fascia surrounding the spinal column can be the second source of the low back pain. There are ligaments, so ligament sprains. There are muscles, so muscle strains. There are some joints, which is the facet joint in the vertebral column itself, or you have the sacroiliac joint that can also cause the pain in that low back area. And one of the other most common causes your disc between the vertebral bodies that can also cause the low back pain. So we wanted to kind of introduce you guys to, some of the medical like terminologies that you will hear from the doctors, or you will see this common medical diagnosis that will be used. The first and the foremost like diagnosis, which is very common, is it's it's being told, oh yeah, you guys have like disc herniation or we have disc protrusion, and that can happen because of normal age-related changes, or it can happen because of like sudden lifting or carrying or twisting. The second is the facet joint that I mentioned in the last slide. So there can be like some facet joint dysfunction. It can again happen because of age-related normal changes. It can happen from a sudden trauma, or it can happen from repetitive lifting or carrying or twisting. The third category is spondylolisthesis, which means one of the vertebral body has shifted in comparison or relation to the other vertebral body. It can be present from birth. It can be due to trauma, or it can be involvement in some repetitive activity, which involves a lot of like back extensions, such as the gymnast or horseback riders. As we mentioned before, we can have muscle strains or ligament sprains from carrying something suddenly or lifting something suddenly or twisting. The other category is osteoporosis, more common again in females. It's essentially weakening of the bones. The osteoporosis can happen because of some medical conditions, some medications. It can happen because of sedentary lifestyle or inactivity. And it can lead to like further fractures or compression fractures in the spine. Sacroiliac dysfunction, commonly known as like SI joint pain. So SI joint pain is very common during pregnancy because there's like ligament laxity associated with hormonal changes, or there's a trauma, and that's why we see SI joint dysfunctions. The next one is your lumbar instability, which we love to define it as clinical lumbar instability. It means that there is a muscle imbalance, and your muscle imbalance is not able to tolerate the load that you're putting on the spine. So your therapist will talk about like strengthening the appropriate muscles to be able to gradually load the spine. Spinal stenosis, very common with aging. Patients or clients can have pain with like pain more so in the legs actually, maybe in one leg or maybe in both legs. And usually the common complaints are I have more pain with standing or walking. It gets better with leaning forward or sitting down. Again, being in prolonged postural dysfunctions, that can also lead to muscle inefficiency, and those muscle inefficiencies can lead to like low back pain. And the last category is your compression fractures. So I mentioned earlier about the osteoporosis and weakening of the bones. That can lead to commonly like compression fractures, or a sudden trauma can also lead to compression fractures. Thank you again. My colleague Jasmine Carroll is going to go through the next section where she's going to talk about when to seek medical advice and what are some of the signs and symptoms you guys shouldn't be ignoring about and when to kind of talk to your doctor about.
Okay, hi everyone. My name is Jasmine Carroll, as mentioned. So I'll be talking more about when it's most appropriate to see professional help regarding low back pain. While most low back pain is typically not as serious and can heal on its own, there are times where seeking help could be beneficial regarding your recovery, regarding like just easing your mind, as well as getting assessed and see if there's any more serious conditions that may come about and getting evaluated early on. So when should you consider seeing a professional? So before I even get into that, I want to start off by saying that you don't need to live with back pain indefinitely before seeking help, but these are a few instances when it may be more appropriate to seek professional help. So if your back pain is lasting longer than about 2 to 4 weeks, if it continues and comes back frequently over about a year or even longer, if it's starting to interfere with your daily activities, your work, your sporting activities, recreational, or if it's starting even to bother your sleep, that's a good indicator of needing to seek outside help. Also, if you start becoming like nervous and anxious about just moving in general, as well as if you're unsure of like what exercises are safe for your low back pain, that's a good indicator. And also if your back pain is a result of a fall or even like a serious accident or injury that took place. So red flags. So there are common, well, not even common, sorry. There are particular signs and symptoms that are needed to be addressed if seen, but they are rare. So these symptoms can be numbness or tingling in both of your legs, a sudden or severe unexplained weakness in the legs, as well as a loss of bladder or bowel control, as well as fever or chills within your body when you have back pain, as well as unexplained weight loss associated with back pain. And also, if you have like a personal history of cancer, osteoporosis, or even a recent trauma, those are things that need to be addressed more urgently. But early evaluation can also help with this, and also physical therapists are trained to address these red flags and also allow you to know when it's appropriate to see outside help, and we will refer you back to a healthcare provider when needed. So physical therapy is a great first step, though. So physical therapists are trained in not only identifying those red flags, but we are trained in diagnosing and whether your back pain is mechanical or medical. We are movement experts, so we do a lot of evaluation of strength, range of motion. We look at your movement, we look at your function. We also look at like the nerve function to see what is needed to be worked on in order to help with your back pain. And as mentioned, we also will refer you out if needed, if we find anything that's outside of our scope of practice. And we can also help avoid unnecessary treatment, such as imaging and prescriptions. So did you know that you can see a physical therapist without a referral? So this is called direct access. So a lot of US states, all of them, or have modified at least some of their policies regarding access to physical therapy. And so every state has either lifted or changed some of their referral requirements. So that means that physical therapists can provide evaluations as well as treatment without the need of a referral order from a healthcare provider. So that means you can seek physical therapy services and go see a physical therapist without needing to see your primary care physician first. And this ultimately will save time, save money, and also get you moving a lot sooner. But I would like to also have a disclaimer that some insurance plans do still require a referral from your physician. So I would like you to go ahead and look at your own benefits and make sure that you're following those procedures appropriately. And also look at your state policies because they do differ among the states. So when might you be referred out of physical therapy? So while many people will approve of physical therapy and help relieve their back pain, there are sometimes a need to be referred out. And that is typically when you're not progressing in physical therapy, your symptoms start to worsen. If imaging or even other further medical interventions may be appropriate. And also if we notice any signs that are non-neuromuscular related. So that means if we see any of those red flags I mentioned earlier that are not related to like the bone, the nerve, the muscle, the tendon, the ligaments, anything outside of that, that is whenever you're typically referred out to see further help. So imaging, this is a big question, right? Is it needed? So imaging provides visual information of your internal body structures and function. So that is typically whenever you get like x-rays, MRIs, you get a CT scan, you get an ultrasound, things of those nature. And many people think that you need some form of imaging right away, but that's not always the case. Imaging is not always helpful earlier on. And that is because imaging oftentimes doesn't provide information on the cause of someone's pain. And also, it oftentimes doesn't um, assist a physical therapist's plan of care for that patient either. So as physical therapists, we really rely on our own patient evaluation to help with their plan of care and our interventions that are utilized within treatment. And also imaging can increase fear as well as over medicalization. So that is typically like further imaging and other medical interventions such as like surgery or such as other procedures that are outside of our scope of practice, but that's typically where imaging kind of leads to sometimes. So again, imaging continued. So studies have shown actually that many people without back pain actually have abnormal findings or an imaging. So that's typically whenever you have things such as like disc bulges as well as degeneration changes. And I want to also make note that this is not just related to back pain. This is typically seen with any type of pain that you may experience within your body. So that is why I mentioned earlier that we typically don't rely on imaging to help with treatment. And also to further get an idea of what this means is that if you take like two people out in the world, like on the street, and you give imaging, like say an MRI, and let's say both of them have the exact same findings, one person may have pain and the other person may not. And so that is the reason why we typically don't rely on imaging to help with our treatment. We rely on our evaluation and what your concerns and needs are. So outside of that, however, imaging can be helpful when there are those red flags that we mentioned earlier. If there's a history of a trauma or accident that took place, or when symptoms simply just don't improve. But like I said before, imaging is not always the first step and it's not always needed at the start. So surgery, right? Another big question. Do you need surgery? So luckily, surgery is rarely needed in most types of low back pain. It's only really needed in those particular instances where, for example, you have persistent nerve compression causing weakness in the leg. So again, that weakness in both legs is one of those red flags that is sudden, as well if you have like some structural instability that is just causing you to have that pain and just not being stable with all of your function. And if symptoms just fail to improve with conservative care. So if you tried physical therapy weeks on end, and then we end up talking with your physician and we all kind of work together, then we'll determine a most appropriate plan of care after conservative care has taken place. And so, as mentioned, like most people recover fully without surgery. They typically improve with movement, with education, with exercise, and luckily, physical therapy is an expert in all those things. And so, to recap, basically, the take home key takeaways, right, from what I just talked about, I just want to reiterate that most low back pain, it does improve without imaging or surgery. Red flags are rare, but they are important to recognize, and physical therapy is a great first step because it is safe, it is evidence-based, and we will get you back to what you love. And if not, we know the next step to take place. We can talk to other healthcare professionals and get you moving in the right direction. So in the next section of this webinar, I am going to pass it on along to my colleague Jennifer McLaughlin. She will discuss like self-management and discuss more on the role of physical therapy in regards to low back pain.
Hi, my name is Jennifer McLaughlin. I'm from the Kansas City, Missouri market, and I'm a physical therapist. And we're going to talk about self-management and the role of physical therapy. So first steps, what can you do if you experience low back pain? So your self-management options include general exercise, so just staying active, stretching, and strength training. Oftentimes patients will, go and try to seek out information online, which is fine. I love it when patients try to inform themselves. And so that's really great. Sometimes what that does when you look online, it gives you very general information. And as Kenna and Jasmine outlined earlier, there's very specific conditions, pathologies, and sometimes if you do have symptoms that are extending beyond your back, maybe into your leg, sometimes certain exercises can increase symptoms. And if you're noticing that, then sometimes that's a good indication of maybe now it's a good time to seek, more guided expertise here. You can also use heat, nonsteroidal anti-inflammatories as well for acute low back pain and short-term relief of your symptoms. The most important thing, though, I will say, is remaining active as tolerated and avoiding bed rest or prolonged periods of inactivity. I find that it's very common for patients, especially when they come into therapy, once they've tried conservative care, they'll say, I just stopped doing everything because I was afraid that I was going to make things worse. And so our body really to heal, it needs movement. Movement promotes circulation. It promotes oxygenation to our tissues. And without that, it's very difficult to heal. So maintaining your activity levels, obviously at a modified format, is very important. So physical therapy's role. So, Jasmine touched on earlier, when you come to a physical therapist, we're going to do a complete evaluation. This includes reviewing your medical history, your symptoms, your management of your symptoms up to this point, your activity limitations, and your goals. And in addition to that, we're going to do a thorough objective evaluation, which includes looking at your posture, how you're walking. If you do have lower extremity symptoms, we're probably going to do a screen of your reflexes, your sensation, your strength. We're also going to look at the range of motion of your spine, your hips. We're going to look at core and hip strength, and we're also going to look how your tissues and your joints move. From there, we're going to work together with you and based on your goals to determine a plan that's going to be best for you to get back to your activities. So our role continued. So what are some of the options that we offer? We offer joint mobilization and manipulations, basically trying to improve the mobility of your joints. Most patients benefit from this. It's researched highly and it shows benefits there. Soft tissue can have benefits early on and for short-term relief, but really better when combined with other treatments. Our joint mobilizations and manipulations are really effective in combination with exercise as well. Joint mobilizations, as we used to think back when manual therapy first started way back, is not to put things back into place, but rather we're improving mobility. And more recently, we're finding that it affects things at a spinal cord level. And so we're actually working more on decreasing maybe adverse muscle tone, improving how your muscles function with our joint mobilizations and manipulations. Also, again, as mentioned earlier, we're going to look at your neural mobility. So we're going to offer options to improve how your nerves move. And as well as provide education on, what pathology you are presenting with, what we believe is going on, how you can help yourself, posture education, lifting mechanics, and then also give you a specific home program that's tailored to you and based on what we found in your evaluation. So joint mobilization and manipulation. So there's different areas that we can focus on here. Obviously, if we're seeing you for your lumbar spine, we can do joint treatment in the lumbar spine. That's been shown to be very effective in, again, reducing that adverse muscle tone, but also improving recruitment of the muscles that we want to be working. This also applies to treating your thoracic spine as well. Many individuals have stiffness in their thoracic spine. Oftentimes what happens is you have stiffness in your thoracic spine, and sometimes your body has to borrow movement from somewhere else. Sometimes it'll do that in your lumbar spine. We call this hypermobility. And so oftentimes, we might be treating areas adjacent to the area that you're actually coming to be seen, but then maybe we're working on stabilization in that area where you're having your symptoms. We can also do joint mobilization manipulations to your sacroiliac joint. This treatment has been shown to be effective in improving hip strength and reducing low back pain. We can also work on hip joint mobility, and improving hip mobility can also reduce low back pain, and this has been shown in the research as well. So massage and soft tissue. So I touched on this a little bit earlier. This can have a benefit early on for short-term relief in order to reduce that muscle tone that maybe we don't want. But long-term manual therapy and exercise is really more effective. We often use hands-on techniques. We can also use cupping, the use of tools. I would also probably group dry needling within this category as well. So stabilization and strengthening. So trunk strengthening and specific core stabilization training has the most consistency in the research to reduce pain and improve disability with low back pain. We usually focus on specific muscle groups based on your individual evaluation, but some common areas that we tend to focus on are your transverse abdominis, pelvic floor, and your multifidi muscles, which are all part of your core. We also apply hip strengthening. This can contribute and help with pain reduction. In some cases, overall physical function and balance in patients that present with nonspecific low back pain. Muscles that we may focus on here are your hip abductors, your adductors, your external rotators, as well as like your glute muscles. So neural mobilizations or nerve glides, if you've been in therapy, you may have heard that term. So your nerves can become irritated with low back pain, either as a result of inflammation or potentially a mechanical issue. Nerves need space, they need movement, and they need good blood supply. And so nerve mobilizations are a healthy way to address these grouchy nerves and their surrounding tissues in order to regain normal mobility and regain function of the nervous system. It typically benefits patients that present with leg pain. So oftentimes if you have leg pain, this is likely going to be a part of your program. This is one of those things that, when we use them, it's very important to educate our patients on, what they should be feeling, because oftentimes our patients are overachievers and they want to do, the most, and they want to get the most out of their session. And so sometimes they overstretch. And so a lot of times with nerve glides and nerve mobilizations, less is more. And so, these are things that, we really want to provide a lot of education on in order to make sure that you're doing the correct exercises. Patient education is a huge component of what we do. So we give you information about your presentation, how you can manage your symptoms at home exercise programs, and then we also provide education about lifting mechanics, how to properly lift, making sure that we're getting down close to whatever it is we're lifting. We're bending our knees, we're not flexing through our spine. We're giving posture education. It's really good to do posture corrections regularly throughout your day. I often recommend people put like a sticker on their computer at work or set a timer on their phone. And, every time you look at that sticker or every time your timer goes off, check your posture. Is there something that you can correct to improve that? Because again, as Kenna and Jasmine mentioned earlier, a lot of our sustained postures are risk factors for low back pain. So we want to make sure that we're doing those things consistently throughout our day. Another thing that we also use, especially for chronic low back pain, is called pain neuroscience education. And basically what that is it's an effective way to understand how our brain interprets pain in order to help you decrease your, if you have fear of movement, maybe if you're afraid that if I move in a certain way, I'm going to hurt myself, or the perceived threat to yourself. So oftentimes that education helps understand those things. So other important information, I typically ask patients, regardless of what they're coming to see me for, 3 questions. What is your diet like? How are you sleeping? And what do you do for exercise? So in terms of nutrition, what you eat can either negatively or positively impact your recovery. Eating a lot of highly processed foods or foods high in sugar can negatively impact your outcomes, and it's actually associated with a higher incidence of chronic pain. But on the flip side of that, eating a good balance of proteins, fruits, vegetables, whole grains, omega-3 fatty acids can help facilitate healing, and it's associated with a lower incidence of chronic pain. I am not a dietitian or a nutritionist, so I kind of know generally in terms of like what is good for healing and what's not. But if you have more questions on that, I would definitely consult a dietitian or a nutritionist if you're working on healing from something. Sleep is also really important. Again, we touched on this earlier. Stress and sleep can affect your overall presentation. So the recommendation is for at least 8 hours of sleep per night. Sleep can help reduce the risk of chronic conditions and enhance recovery from chronic low back pain. So it's kind of one of those vicious cycles. Sometimes if you're having pain at night, it's waking you up, you're not sleeping well, and then sleep can negatively impact your back pain. So if through physical therapy we can help you get a little bit more sleep, then that's going to overall impact your outcome in therapy as well. Exercise. We know that general exercise, including aerobic exercise, has high quality research showing that it's effective for chronic low back pain. According to the Department of Health and Human Services, 150 to 300 minutes per week of moderate intensity exercise or 75 to 100 minutes per week of vigorous intensity aerobic exercise is recommended. It's also recommended that you perform muscle strengthening exercises involving all your major muscle groups 2 days per week. And then if you're sitting here thinking, but what if, I have an injury, or what if, I don't have the same stamina? As in older individuals, the recommendation is remaining as physically active as your condition allows. So still remaining active, but maybe not meeting these guidelines as is laid out in our recommendations.